everyone, I'm Natalie Kunzman, MD, and I've had some questions about what exactly is individualized patient care. Now, there are approximately 7 principles that are components that are essential to provide individualized health care, and one of them is pretty obvious that the care and the treatment is really aimed at providing a holistic well-being for the patients. Now, the values and principles and plans and even leadership involved in this, in any healthcare system that is promoting this, are really geared towards individualizing the care for the patient. Now, there should be a very efficient communication and a collaboration. And those are the keys to making sure that this type of health care is being provided appropriately. Now, and this is the reason why I got fellowship trained and functionally trained, I believe, and one of the principles is understanding and respecting the patient and the family on a deeper level, because each patient's background preferences and values and culture and socioeconomic status plays a role in their health care and what we can offer and what they believe and will accept. Now, the healthcare provider-patient relationship should be in decision making in regards to these care and treatment plans. Now, family members are encouraged to always be present and participate in the care setting for these patients. Now, any information or updates or medical information from the healthcare providers are keys to helping patients make informed decision. And that's not just the patient, it is the families that are integral to the care. So I would say functional medicine, which is the style of medicine that I deliver. Functional medicine patients are assumed, and I quote, to be co-creators of their health along with their clinicians. Now let's think about that. So this is really an empowering relationship between a patient and a provider who both will share the responsibility for creating the healthcare plan to reach a desired well-being in the end. Now, we can talk about the payment strategies and whether insurance plans will ultimately embrace this style of medicine, but it is the future of medicine. And again, functional medicine will take a lot of the principles from integrative medicine, but also will employ what is called a systems-oriented medical approach that will work with understanding the root cause of people's disease. So this will take into account the personalization of healthcare for each patient, since they are distinct and unique. Again, this relationship between the patient and the practitioner becomes a partnership, such that every portion of a patient's medical history is reviewed in detail, very similarly to integrative medicine that will treat the individual patient and not the disease. So let's think about this, everyone. There are individual genetic underpinnings toward for all of us that are unique and different. We have different biochemistry from each other. Our diet, exercise, sleep, and our energetic fields are uniquely different, that are built in to help us fight whatever disease may come along. Now, don't get me wrong, there are some wonderful allopathic treatments when we need catastrophic care. So we don't want to ignore these treatments or strategies, which are typically medications or surgery, when there is some diseases that need aggressive care. However, the preventive arm of healthcare varies dramatically with each person and family and community and social group, or maybe even a working group. Now, again, socioeconomic status may certainly play a role in what is affordable and what is manageable within the home. Now, non-compliance has been a term that has always been perceived negatively in the allopathic world. And most often there are constraints or very little buy-in with the patient when the physician will mandate a treatment. And again, understanding the patient or even the patient's understanding of the treatment is crucial when we are talking about the delivery or the endpoint that we're trying to meet and how to actually get there. So it will work so much better when the patient can direct the care while the physician can endorse those principles that would actually work toward that goal or would go against that goal. Again, this is a style that I embrace, and I think we are seeing a lot of negativity revolving what is going on in the country right now because we are trying to take the magic bullet against a disease and applying it to all, when in actuality we are going to need to individualize a lot of patients' health and wellness so that they can keep their human body well to prevent disease or an infection. Again, we come to the table throughout the years. We have different sets of traumas. We have different environmental exposures. We may have different social and cultural foods and tolerances. And then, of course, we may have individual allergies or intolerances. And we've even collected infections throughout the years that will create a completely different package that would require, again, a great bond between a physician and a patient so that the physician and the patient can work toward a common goal with health and wellness. Again, that is the optimal individualized patient care that we need to create for the future of medicine to work successfully. Again, I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well